name is Kelsey Cooper. I'm with the LaGuardia PTA program, and today we're going to be going over preparation and donning and doffing of sterile gear prior to wound care. So the first thing that you're going to do is, if you have long hair, make sure that it is tied back and remove any jewelry you may be wearing. Next, you will wash your hands, and after that, everything will be prepped in the sterile area. So the first thing that you want to do is come in and initial and date the tape that you'll be using to close up the bandages. Next, you want to make sure that you have saline solution prepped in the bowl. And then you'll come over and start to prep your surgical sponges. To do this, you want to make sure that you pull it open, only holding the exterior edges and not coming into contact with the gauze. What you can do for the small pieces that you'll be putting into the wound is put them directly into the saline solution. So you'll open as many of those as you need, and then you'll move on to these larger sponges, which can be used to cover up the wound in the end. And again, make sure that you open, only holding the exterior edges, not coming into contact with the gauze. Then you will also need gauze wraps to wrap up the wound in the end. And once again, opening only by the exterior edges. The next set of gear that you will be putting on is what you will be wearing. You're going to begin with your surgical mask. Just place it on your face and make sure that the front is secure and the strap around the back of your head. Next, you will have your gown, and you want to make sure that the opening is in the back. Once you have that on, you want to secure the ties behind you. The last thing that you'll be putting on are your sterile gloves. And these you want to open like you did with the gauze sponges, making sure that you don't touch the outside edge of the gloves. When you open the gloves, they'll be folded down so that there is an interior cuff that you can touch. And then you want to just tuck the gloves into the sleeves of your robe. And now you're all set to do wound care. In this portion of the video, we'll discuss what to do after you have completed dressing the wound. You need to clean up your area. So first you want to gather together all trash left over from the items that you've used, combine it together. After you have that set, you want to remove the sterile gear. First, you want to remove your gloves, making sure not to come into skin contact with the external part of the glove. Next, you want to remove your mask. And lastly, you'll want to remove the rope. And then dispose of all of that appropriately.
Hello, my name is Dan Madera,
My name is Kavi Guru.
and we're LaGuardia students here at the PTA program. And today what we're going to demonstrate is the TENS unit. And TENS stands for Transcutaneous Electrical Nerve Stimulation. And TENS, what it's used for, exclusively for pain management. So what we're going to do is we're going to demonstrate a scenario in which Mr. Gurung has a wrist pain on his right wrist extensors. And then from there, we're gonna show you, talk about key questions that you need to ask, pad placement, and things you need to be cognizant of, and patient education, which is crucial for a TENS unit. Before you apply the TENS unit, you want to ask your patient a few questions to make sure that this modality is not contraindicated. So, Mr. Gurung, I'm going to ask you a couple of questions, okay? Just to make sure that you're a candidate for this machine, okay? So, the first question I'm going to ask you is, do you have any cardiac pacemaker, anything like that? No, okay. Do you have any malignant tumors, any skin cancer that need to be worried about? No? Do you have any irritated or broken skin? No? Okay. Or do you have any adverse reaction to a gel pad? Have you had this before? With this, you have any problems with this before? No. And are you taking any pain medication, or do you take a lot of caffeine?
No, a little bit.
A little bit, but not that
not
much. Like how many cups of coffee?
Like a cup of coffee. A day.
Okay, well, that's fine. And if they're a woman, you're also going to ask if they're pregnant. And if they're not, then this patient is an ideal candidate for the TENS unit. Now that we got the questions out of the way, the next step is actually feeling the body part that's affected for a pad placement. So in Mr. Gurung's particular case, he has wrist extensor pain on his right arm. And so a good trick to do before you actually apply the pad placement is to actually feel for the muscle belly. So you can do like a small muscle test, and you can tell Mr. Gurung, can you please just raise your wrist up just like that? And you see right there that the muscle belly pops out. So you can bring it back down. So now that we got a general idea of where the muscle belly is, the wrist extensor mass, now you could apply the pads. So there's two key things that you want to do before you apply the things you need to know about before you apply the pad, and that is you want to ensure that you don't put the pad over any bony prominences, and that you keep 2 inches of separation away from each pad. Okay, so now we're ready to place the pads on you, okay? So can you just raise your wrist for me a little bit, just like that? Okay, we got it, all right. And like I said, you want to make sure it's not over any bony prominences. Make sure the pigtails are away from the body just to create less mess and tangle. The other one, like I said, I want to keep at least 2 inches away, or two fingers away from each other, like right there. Okay, so right here, you can feel it, very soft. So this is a perfect pad placement. It's not over any bony prominences, and it's right over the muscle belly, which is the area that we're targeting. Okay. So now that we got the pads on, now we want to find out what type of application of TENS we're actually going to apply to the patient. So in order to do that, we need to ask a couple of questions and determine why Mr. Gurung is here. And this will let us know what we're going to use. So if Mr. Gurung says that
I work in office. I use computer all day, and I need to type all day long, and I got this pain from typing.
Okay. So in this case, Mr. Gurung is in his office all day, and he could ideally have the TENS unit on him for 24 hours when he brings it to work. So in this case, conventional TENS would be the ideal application. However, Mr. Gurung says that
I play tennis in the weekend, and I have pain on my lateral epicondyle on this side.
Okay, so in this case, Mr. Gurung is a very smart patient because he knows that he has pain in his lateral epicondyle. And so in this case, low rate TENS would be the ideal application because that's something he could apply before he would play tennis, and it should relieve the pain for 4 to 5 hours because of the endogenous release theory of low rate TENS. All right? So what we're going to do is we're going to go with the first scenario, and we're going to apply conventional TENS. So now what we're going to do is we're going to go with the first scenario. And if you remember with the first scenario, he's a person that types all day, so we're going to use conventional TENS because it's ideal for Mr. Gurung in this case. And I'm going to set the machine up beforehand. So what you want to do is you want to set the pulse width between 50 and 80 microseconds, and that allows to just target the alpha beta nerves. And you want to set the pulse frequency between 100 and 150 pulses per second, and you want to set the time at continuous and the mode at normal, and this will allow the patient to have conventional TENS. Okay, so once you have that set up, you already set up the machine. You're gonna talk to Mr. Gurung and you're gonna tell him this. So Mr. Gurung, I already set up the machine.
Okay.
Now the only thing you're gonna have to do is just move this knob here, and this is gonna set the intensity of this application. Okay? So what you should feel is only a tingling and vibrating sensation. And then once you feel that sensation, then you stop, and then you close the machine. Okay? Now, if anything were to happen, if it stops working for any reason, or you feel like you're not getting the same amount of treatment, then you don't mess with it. Just turn it off, and then you just bring it in your next visit. Okay? All right? So what I'm gonna do is I'm gonna turn this on, and you're gonna tell me when you actually feel a tingling sensation. And you'll see the light here turns on. Okay? So that you know it's working. Okay? And you're gonna turn this knob, right? Because this is where the unit is plugged into. Okay? So I'm just gonna raise it here, and I just want you to just tell me what you feel.
It.
You feel it?
Yeah.
Okay, that's what you want to feel. Okay? Once you got that, you just close it, and you're good to go all day. And you can put this in your on your belt or anything like that on your pants, somewhere where it's safe.
So
Oh, that's a little bit too much, and we're gonna close that one just a little bit. There you go. How's that? Is that better?
Hi, I'm Alicia Medley, and I'm a PTA student here at LaGuardia. I'm just going to be walking through with you guys how to set up the TENS machine for low rate TENS, or also called acupuncture TENS. So if you're with your patient, you just want to open up this, and this gives you the ability to set the frequency as well as the pulse duration. So, there we go. So for low rate TENS, the frequency should be between 2 to 10 pulses per second. You can see on the machine right here, it starts at 2. You can see a little arrow points at 2, and all the way to 10. So depending on the level of comfort for your patient, and also if it's their first treatment session, you can start at 2. For here, just show you, put it here, and this would be about 5 pulses per second frequency. And then for pulse width, or also called pulse duration, for low rate TENS, you want to be between 2 to 300 microseconds. And you can see here on the TENS machine, you can see 230 is listed there. You want to be at 200, just be a little bit before, and then you can see the machine only goes up to 250. So again, with patient comfort, we'll just set it here for 230. For your time, for low rate TENS, the treatment session will be between about 20 to 30 minutes. So you just want to click it here to the left and set the timer at 30 minutes. And then also down here, you just want to set it and be at normal. After that, you just go ahead and close the unit here, making sure that you're completely plugged in, and also you're attached to your actual pads here. For low rate TENS, polarity doesn't matter. So red or black, it doesn't matter. Place the pads on your patient, and then we can go ahead here and set the intensity. If it's going to be on the right-hand side, you would be setting the intensity on the right side of the dial. You can see here by clicking it on, you turn on your light, showing that you have power to the actual TENS unit. And again, level of comfort, you're going to start slowly coming up, and then once the pads are placed on your patient, you're going to be looking for an actual muscle contraction. Once you've reached that muscle contraction, again, you can go ahead and set a timer 20 to 30 minutes. And this treatment session, let's go ahead and turn that off here. And that treatment session should last for your patient about 4 to 5 hours, because this uses the opioid release theory. So when you are sending this home, you could, of course, send this home with your patient. You can let them know that everything is already preset for them. So they don't need to go ahead and move any of these things. This should remain the same. If they're not feeling as intense of a contraction, you could see that maybe the battery has worn out, and go ahead and you can instruct your patient to maybe replace the battery. And then also note what the intensity level is and have them go to that every single time. So they would just be adjusting right here, the intensity. If they replace the battery and it still is not working for them, I would have them come back to the office or the clinic. And what you would want to do is actually set the machine to modulate. Just by clicking it here on the right side, you could set it to modulate. This would just give them, they may have built up immunity to what has been happening with previous treatments. So modulate will just give them a different type of frequency and pulse width randomly. Okay, and that would be it. And this would go home with your patient. Thank you. Hi, so I'm just going to be showing how to set up for burst mode this time. Again, open here. So on this machine, you can see that there's a B that actually stands for burst. So by clicking it to the left, you're presetting the frequency to 10 units. And then for pulse width, you want to be between 100 to 300 microseconds. So you can see here it's 110, so you'd be a little bit under, again, depending on patient comfort. And this machine only goes up to 250, not to 300, so anywhere between about here all the way over. Once it's, you can see the time here, again, just like low rate 10s, you'd be clicking it to the left, setting it to 30 minutes. So treatment time should last anywhere between 20 to 30 minutes. Close that there. Set the intensity after you placed the pads on the patient. Set the intensity to visible muscle contraction. Just like you had with the low rate 10s, it uses the opioid theory. So the pain relief that the patient should be feeling should last between like 4 to 5 hours. For burst mode, it is important to note that for many patients, this is actually considered a much more comfortable than low rate 10s. The last setting I'm going to be showing is brief intense, the setting that you would actually be doing in the clinic only. This would not be something that you would send home to your with your patient. So when they come into the office, you're going to be setting here. You want to be greater than, for your frequency, anywhere greater than 80 pulses per second. So you can see here that you would turn off this to, this starts at 60. You could see anywhere from about here. And this would be like 115, so we just set it there just for, just to show. And then pulses width or pulse duration, you would be anything greater than 150 microseconds. So you can see here, about anywhere from like there and then over. For this, you would want to be set at normal, and the time you would want to leave it continuous. It is important to note that the treatment time is going to vary largely, anywhere between 30 to 180 minutes for a treatment session. For brief intense, when you open up here, again, after you paste the pads on the patient, you're going to be turning up the intensity to you receive a noxious stimulus from your patient, or the highest level of tolerance, pain tolerance for your patient, which is going to be a visible muscle contraction. Again, this uses the opioid theory, so the pain relief that they should be feeling should last anywhere for 4 to 5 hours. Brief intense is especially good for treating if you're doing wound care or you have to redress a very painful wound dressing, anything along those lines. You would be using brief intense for. Okay.
Hi, I'm Miguel Trinidad, physical therapist assistant here at LaGuardia Community College. Today I'll be showing you pad placement for the transcutaneous electrical stimulation unit. The first thing you want to do when placing pads is to get over the muscle belly of the muscle. So for the demonstration, David here is going to show how we're going to put it on the bicep muscle. So we're going to put it right in between the muscle belly there. Alright, we're going to make sure that it sticks on. We're going to take another one and put it about 2 inches away. or 2 finger lengths. Okay? Now my friend Kabi here, we're going to demonstrate how to put it on the tricep. So as we know, the tricep runs right along here. So we're going to want to put it right on top of the muscle belly. And the next one just below it. Again, 2 finger places. And that's how you put it. Hi, it's me again. Now I'm going to show you how to put pads on a shoulder joint. So it's going to be the same concept. You want to put it on the muscle belly. Now with the shoulder joint, it's a little tricky. We have bone here, right? So what we want to do is avoid placing the pad over bone. So what you want to do first is palpate. Okay, all right. Well, bone is here. So we want to put this bad boy right here. All right. Again, put it right underneath. And we're going to connect that to one channel. Now, to do the quad technique, we can do an anterior and posterior. So we can put it here. And right behind it. So now you have a quad technique hitting the middle of this muscle. And that's how you do the shoulder joint. Thank you. So now we're gonna do pad placement for wrist flexors and for carpal tunnel. So first, we're gonna show you how to do pad placement for wrist flexors. So right here, you want to get, again, you want a contraction, you want to get on the muscle belly. So you want to get on the flexor mass. So I'm going to put one here, right on top of that big belly. And the next one, we'll put it a little lower. Again, you want to watch for the bone. Get right on that belly. So that'll be a good one there. Alright, and that should be able to flex the wrist. Now, for pain management, Kelsey here has carpal tunnel syndrome. So with carpal tunnel syndrome, we want to use a unipolar technique because the area is usually a small area. So what we'll do is we'll use a dispersive pad. That could be usually on the bicep for carpal tunnel, right? Then we want to use the pad that we're going to use, and with carpal tunnel it could be anywhere from here down. So you could put a pad here, a pad here, or a pad here. Hi, it's me again. Now I'm going to show you how to place pads on the traps, the upper traps, and the mid traps. So, Kabi has pain on his left trapezius muscle. What we want to do is we find the trigger point, right? Well, if he has pain in a specific area, we'll see, we'll palpate. And then we'll place the pads accordingly. So let's say he has pain here on his upper trap. What we'll do is we'll put one pad there and another pad there. Now that's specifically for the left side of the trap. Now, let's say he has them across. I want to put a pad right between the spine, not on top of the spine, right between it. Another one here, and that'll concentrate the area right underneath the bone. Now let's say we want to get the rhomboids. It's the same deal. Rhomboids are about here, pad here, pad here. Let's say we want to get just the right side of the rhomboid. pad here and a pad there. And that's how you place pads on the traps and lower traps. Thank you. Okay, so now we're gonna do the lower back. Now for Kabi, he has pain in the lower back. So since the lower back is a pretty big area, we can use a bigger pad. And we'll place it right across here. And let's say he has it around the middle here. Place another one here. Like so. And that'll hit the whole lower back area. Alright, so now we're gonna do pad placement for the quadricep muscle. So since David is a pretty large man here, he has big quads. So what we want to use is big pads for the big man, huh? Alright, so the first thing we want to do is put a pad on the vastus medialis. So that could be the VMO. So we can put it right here. And again, you have the patella here, right? So you want to avoid placing it anywhere near the bone on the patella. Now for the next pad, we could place it on the lateral side. So it'll be somewhere around here. And if they do, you could turn your leg over. Show the camera, please. That bad boy right there. Okay. All right, and that's how you place it on the quadricep muscle. All right, so now we're gonna do pad placement for the knee joint. Now, the knee joint, you have the patella right in the middle. So what you wanna do is basically just go around it, right? Now, let's say the pain is on top. We can just use 2 pads and place it right beside that knee joint. Right? The same can be said if the pain was in the lower portion next to the tibia and the fibula. Now, let's say we want to get, the whole knee joint. We can do a quad technique. Again, you want to palpate for bony prominences, bony areas. Okay, so he has a good nice muscle right there. You want to get on the muscle belly. And you want to put that as a pad again. Palpate. Make sure you're not on bone. Put it on the muscle belly. So here we have all 4 going at it at the knee joint. Okay, we have the semitendinosus, semimembranosus, biceps femoris. Okay, so we can place pads on the muscle bellies of each. So let's say he had pain more on the lateral side. We want to get right on that biceps femoris muscle belly. So palpate. And right about there is a good spot. Alright. I want to get that muscle belly there. Now let's say it's tendinosis or membranosus pain. We're going to do the same thing. I'm going to get right on that muscle belly. Depending where the pain is, we want to get right on that spot. So there we go. And there we go. And I set it up perfectly for a quad technique, right? So we have all 4 going at the same time. Now, let's say we wanted to get the gastrocnemius, right? We can place a pad here, pad there. So gastroc is pretty large muscle. David's a pretty big guy. We can probably do a quad technique here to get right in there. Okay? Now, oh, sorry, David. Okay, so now let's say he has pain in the Achilles tendon, right? What we want to do is, since the Achilles tendon is a small area, we want to put the pad that we're using right on the Achilles tendon. Right? We can fold it up a little bit. Make sure it's sticking. Okay? Then we'll take the dispersive pad and put it on a larger area. We have the gastroc right there for us. Put it on, and we can do a unipolar technique for the Achilles tendon there. All right. Now let's say in this area that the pad is not sticking, we can get we could get an ace band or wrap and wrap it around like so. And that's how you do the hamstrings, gastroc, and Achilles tendon. Okay, so now for the tibialis anterior, we want to get on the belly of it. So the tibialis anterior is pretty easy to find. So you can see the muscle belly here, right? So we want to put it right on top. And if you can't find it, just ask the patient to dorsiflex. So David, can you dorsiflex for me? So you see it pop out right there, okay? You just put that right on the belly. Now, again, you know what runs through here, right? You have the tibia here and the fibula. So you want to put it right on the belly. Make sure the pads are sticking. And that's it. All right. Now, as we know, the tibialis anterior runs all the way down to the ankle. And in the ankle, we have small joints, small muscles. But there's, we have bony areas. We have the malleolus around there. So when putting tens, you want to make sure that you go around this bony area right here, the malleolus. So we can put a pad here, like so. And we can even put a pad right around it, right behind it, right? Going into the Achilles, right? Or we could put one right here using a quad technique. Again, depending on your patient's pathology, if there's pain, where the pain is at, you can use either unipolar technique or bipolar technique for the ankle. Not so much a quad, because a quad is more for a big area. Thank you. Okay, now this time we are going to show you how to place pads on the thenar eminence and the hypothenar eminence. Now, we want to use a small pad on the, let's say we're doing the thenar eminence. I want to place small pads using the unipolar technique right around that thumb area. Now, as you can see, it's hard to get the pad to stick. So, hey, tough guy, can you pass me that? Oh, all right. John Elway over here. So, we want to use the ace band to wrap this area, right? Make sure that it's on. So here, it's on there. And we can wrap that area, right? Now, we can place the dispersive pad right around the forearm area, or if you want to place it on the bicep, that's fine too. So just remember, you want to use a bigger pad for a unipolar dispersive pad, right? Okay? Now the same thing we can do for the hypothenar eminence. Again, put it right around, fold it around. Now with the hypo, that looks a little better. So as you can see, it's sticking all around, so we don't really need the ace band. Alright? So that's how we do the thenar eminence and hypothenar eminence using a unipolar technique.